Hi, my name is Dr. Nicole Friels, and I'm here today to talk about plantar fasciitis. Plantar fasciitis is by far one of the most common issues I personally treat. There are a lot of other common factors that can mask as plantar fasciitis, such as tarsal tunnel syndrome and also radiculopathy, which means back pain that extends down into the feet. A lot of things are missed, so if you feel that you've had plantar fasciitis for months and months and months or years and years and it's not gone away, or maybe it goes away and then it comes back, it's likely not plantar fasciitis. You may have a component of plantar fasciitis that still needs to be addressed, but we need to evaluate for other things such as the tarsal tunnel and radiculopathy. Plantar fasciitis is similar to a rubber band. It attaches from the heel and moves all the way to the whole forefoot. It essentially supports your entire arch. We commonly get it because of two reasons. One, it's too tight, or two, you don't have proper support to elevate the fascia to support it whenever you're walking or standing a lot, especially if you work on concrete in a hospital, or if you're even a teacher and you're walking around chasing kids a lot. Very important to keep this structure loosened up and then also supported. If you go barefoot, that's a huge trigger. Your plantar fascia will definitely get irritated. So even when you're in the house, make sure you have a nice, well-supported cushion house slipper on. I really like Acorn house slippers, and they're available here in town from Sportsman's Warehouse here in Hamburg. So it's right around the corner from us. Outside of the house, your foot really doesn't know if it's outside or if it's inside. So make sure you're protecting your feet even more whenever you're going to be on your feet a lot. Cooking, cleaning, laundry, going to the grocery store. Make sure you have your tennis shoes on with the proper insert, depending on your arch type. A lot of people say that they feel pulling in the calf muscle. The reason is it's all connected. Your calf muscle forms the Achilles tendon. The Achilles tendon attaches to the back of the heel. A small portion of those fibers course around the bottom of the heel, and that's what extends to the forefoot. That is the plantar fascia. So if you're getting cramping in the middle of the night, you definitely need to consider stretching more. We have a night splint that we can fit you with to help encourage that. A lot of people don't sleep in it because it's very uncomfortable. I usually recommend wearing it while you are sitting, watching a movie or reading a book, anything like that. Or if you have a sitting job, you can put it on whenever you're on the computer. Anyway, anything to stretch the fascia out as well as the heel cord will help minimize your discomfort. That's why we get the stiffness first thing in the morning, or after you've been sitting for some time. It's pulling on the heel bone. We definitely need to encourage that to stop pulling because you're going to develop heel spurs. That just tells us that it's been here for a very long time. It's not the source of your pain. The source of your pain are the structures, i.e. the Achilles or the plantar fascia pulling on the heel spur. So we need to eliminate that pull. The inflammation builds up around the spur, or even if you don't have a spur, you can still have plantar fasciitis. Again, it's the heel spur is not the source of your pain. It's not a spike. You're not walking on it. We do like to offload it as much as we can, and that's with the insert, of course. During your first appointment, we will take digital x-rays and we will show you any spurring that could be there or any underlying structural issues that are present that you didn't even know about. Maybe there's an old fracture there. We always evaluate the height of the heel. That's very important in determining the proper insert for you. A lot of people, buy the over-the-counter inserts, and unfortunately it just doesn't fit someone with a pes cavus foot or an extremely high arch. So it's important that you get the right arch for your foot, and it's different for just about everybody. We will use the ultrasound. We will look at the plantar fascia. I can evaluate for any tearing, micro tearing that occurs with the plantar fascia. Typically when patients complain that they have had intermittent heel pain off and on over the past several years, and then maybe they were walking on the beach or in the sand and then they all of a sudden have intense pain. Or sometimes you'll hear a pop even. That pop is your plantar fascia that has finally ruptured. Now it's not a full-on rupture most of the time where your arch collapses. However, it's a lot of micro tearing within the plantar fascia, which is extremely painful. This type of pain occurs whenever you can't put your weight on the heel, or every step you're taking it hurts. It hurts to stretch. That's another good point. If you are in physical therapy and your heels hurt, are painful, outside of a normal muscular type pain from working out, you need to stop physical therapy and be evaluated immediately. You could be doing physical therapy on a plantar fascial tear that is actually increasing your pain. So plantar fascial tears, the treatment for that is staying off of it. You need to ice it, we need to support it, we need to get you in an offloading boot, and really just alert you that, hey, there's a more serious issue than plantar fasciitis. So back to plantar fasciitis, we utilize our live ultrasound to evaluate the severity of your plantar fasciitis. That helps us build a treatment plan that's appropriate for you. Outside of that, we can also use it to do an ultrasound guided injection. We'll ensure that we're getting the steroid medication directly into the hot spot where the majority of your inflammation occurs. After that, it feels like a bee sting. A lot of people, say, oh gosh, how painful is it? I've heard of horror stories with this. I don't want to have it done. I tell people, hey, it feels like a bee sting. It's gonna hurt. However, 35 seconds of discomfort is, worth it if you're gonna get significantly better. Several people just have to have one injection. So we can do more than that. I typically recommend no more than 4 in a 12-month period. I encourage after the injection is done to make sure you pack it with a lot of ice. Stay off of it that day. I really don't want you to go to work unless you have a sitting job. I want you to stay off of it for sure. On your first visit, we also talk about inserts. Again, we talk about what is your foot type. Do you have a really high arch? Do you have a really low arch? Whatever the case, we want to build an insert to your foot. We also have a line of semi-custom inserts called Quadriceps. Those are ones that we fit you based on a gait analysis, and you will walk out of the office that day with them. A lot of insurance companies pay for a custom orthotic. Most people do not know this. They typically cover 1 pair a year. There are absolutely plans that exclude this, but it's information that we can gather for you and educate you on your first visit if you like. Shoes. Shoe gear is huge in plantar fasciitis. You've got to find a good supported shoe, something that's too flexible and bendable, something I always say that you can roll up like a burrito, is not good. Get you a nice, well-supported shoe. Based on your foot type during your visit, I will tell you exactly what type and style is best for you. So now we need to put it all together. I've talked a lot about stretching, support, shoes, inserts. It's about the whole thing. A lot of people come in and say, I went to another podiatrist, he told me to stretch and wear these power steps, and I'm not better, and it's been 2 years. You've got to really be aggressive with this at the beginning. I educate you fully on your foot condition, what your triggers are. The goal is to eliminate your triggers. Once you do that, you'll know exactly what's going to cause your plantar fasciitis. And so as long as you're aware of it, then you know how to move forward. I also prescribe anti-inflammatories. That is helpful in reducing inflammation into the fascial area as well. It's not something that I want you to stay on forever. It's something 1 a day as needed. So if you don't have any pain, then you don't take it. We don't want to cover up and mask the underlying issue. That is the true goal with plantar fasciitis. Why do you have it? Structurally, what were you born with? We need to fit you with the best things possible so you can prevent it in the future. That's a goal. We don't want this to come back. We know it's a very common issue. Different things will cause it. However, identifying what those are will help you in the long run.